good evening all. So today is World Blood Donor Day, 14th June 2021, and the theme for this is Give Blood and Keep the World Beating. Next. Transfusion of blood and blood products helps and save millions of lives every year. It can help patients suffering from life-threatening conditions live longer and with higher quality of life. It also has an essential life-saving role in maternal and perinatal care. The aim is to raise global awareness of the need for safe blood and blood products for the transfusion and of critical contribution voluntary unpaid blood donors make to national health systems. Throughout the COVID-19 pandemic, despite limited mobility and other challenges, blood donors in many countries, they have continued to donate blood to patients who need transfusion. Focus of this year's campaign is for 2021 is the World Blood Donor Day slogan will be Give Blood and Keep the World Beating. The message highlights the essential contribution of blood donors make to keeping the world pulsating by saving lives and improving others' health. So I'm Dr. Rakesh Gupta, President and Director of Public Health Strategic Institute for Public Health Education and Research, and I'm former DHS Punjab. And Dr. Sonu Goyal is with me. He is Professor in Department of Community Medicine and School of Public Health, PGI Chandigarh. He is also Program Director for International Public Health Management Development Program, which is sponsored by Ministry of External Affairs, Government of India. So dear viewers, we welcome you all to this very special edition of Cypher Health News channel, coinciding with World Blood Donors Day, 14 June 2021. And it is my proud privilege to introduce Ms. Preeti Sudan, former Secretary Health, Government of India. So Ma'am Preeti Sudan, she is an IAS officer of 1983 batch. She served as a Secretary Health from October 17 to July 2020. She is also a WHO appointed member of the Independent Panel for Pandemic Preparedness and Response. She has a doctorate in economics and social policy and planning from the London School of Economics. She has been trained in public finance management in Washington. In public health community, she is also well known for some of the remarkable decisions, especially for managing NCDs. She made a mark at an international level as a chairperson on COP8 and is well known for a comprehensive ban on electronic cigarettes by Government of India in December 29. She has been the key strategist in times of the COVID-19 pandemic.
Madam Preeti Sudan is one of the most important strategists for world's largest health protection scheme, Ayushman Bharat. She served as a Secretary, Department of Food and Public Distribution, Ministry of Consumer Affairs and Public Distribution. Apart from this, she has served at various central and state level positions such as Joint Secretary in Ministry of Defense, as well as in the position related to disaster management and tourism. She has served as a consultant in World Bank, Washington, and she is well known for her efficient handling of devastating floods which hit Kerala in 2019. Her post-flood disease control mechanism safeguarded a huge number of people across the state who had harbored in the relief camps. On World No Tobacco Day 2021, WHO Director General Special Award was received by Dr. Vardhan, Hon'ble Minister of Health and Family Welfare, Government of India. It was awarded to India because of an excellent work done by Ministry of Health and Family Welfare team, which was led by Madam Preeti Sudan.
So welcome you, ma'am.
So thank you very much. I don't think I deserved such a long introduction. And today is a very special occasion. And I would say that donating blood is actually a win-win situation, both for the donor and the recipient.
So, ma'am, wonderful to have you here in Cypher Health News Talk. And as our customary, we talk to the leaders in public health who has done immense contribution in public health. So, welcome to the show, ma'am. And ma'am, first of all, the viewers will like to know about your education and your journey as an IAS officer.
Well, I am from Haryana, a place called Charkhi Dadri. I am, as you already said, I am I studied, graduated from the, we used to call it Government College for Girls, Government College for Women then, now it's called Government College for Girls. And I studied in Punjab University, Chandigarh, did my master's from there, did my MPhil also, and also I actually taught there. I was ad hoc lecturer in
Right.
my own department. We had an honor school at that time, and I used to teach them. And also the first year master's economics course, I took one course there.
Great.
So I am actually from Chandigarh and Haryana. And I have then, as you already said, I did an MSc from LSC, and I basically in my first attempt in 1983, I got into the civil services. So it's been a very satisfying journey for 37 years. I was in Haryana cadre. I was SDM Narayangarh. Then after my wedding, I went to Andhra Pradesh. And I must say that the cadre treated me very well. My first 10 years were in district postings as sub-collector, as joint collector, as collector. The last 12 years of my service were in Government of India.
Right.
And the rest in Hyderabad, out of which nearly a decade I spent in finance department of that state.
Okay.
So I had a stable tenure, excellent colleagues, very supportive seniors, abundant opportunities to make a difference. It's been a great journey, a great learning experience for me.
Right, ma'am. So, ma'am, you are considered in your fraternity, you are considered as one of the most intellectual bureaucrats with a special interest in public health issues. So, ma'am, considering your vast experience which you are having in health sector and economic sector, what do you think are the immediate tasks at hand for India to overall reach our targets under sustainable development goals, or some specific things about non-communicable diseases?
Well, if you see the Delhi adjusted burden of disease, I'm sure you know that it is NCDs that are now taking precedence over all diseases as an increasing burden, especially amongst the urban population. And this is like, we are sitting on a bomb which will burst if we do not tackle it timely.
Right.
And I'm very glad that India is actually on the journey to tackle it, not only timely, but in a comprehensive manner. So let me divide my, actually, if you ask me that what are the immediate tasks at hand for India, I would say that we should think both short term and long term. So since we are in the COVID situation now, as you know, it's very important that the medicines are available for patients who are suffering from NCDs, diabetes, hypertension, etc. And travel constraints and lockdowns have limited access to preventive services, to hospital treatment, to prescription medicines. And there are special advisories that have been issued by the Ministry of Health and Family Welfare in this regard. And the states are doing considerable good work also, but I think more awareness is also needed on this aspect. Further, I'd like to tell you that in COVID, as you know, that people suffering from NCDs are actually high risk. So triaging of high risk NCD person, ensuring their proper referral is also very, very important.
Right.
I remember that when we, in the first wave of COVID, when, we were struck by this, one important thing that we had done was that the NCD data, because we already, I'll come to that later also, we have considerable data, individual data on NCDs. That was, the states were alerted with that data was shared with them state-wise, so that, at the sub-district level, that kind of an alert on NCD patients could actually take place. So that was one thing. So that's for the short run. But in the long run, if you ask me, I think that there are 4 things that we need to do. First is prevention, early detection, treatment, and then monitoring of NCDs. And I would say that it has to be multi-sectoral, and there has to be a plan. We have to strengthen the healthcare system to address this growing burden, and also reducing population exposure to major NCD risk factors like tobacco, alcohol, unhealthy diet, inadequate physical activity, and household air pollution, for example.
Right.
And if you ask me, we've already embarked on that journey, which I think during our conversation we can talk about it more. Then next is that strengthening the system of program monitoring and surveillance is also very, very important. Now, if you come to, this is the policy part, but if you come to programmatic part, as you know that under the Ayushman Bharat Health and Wellness Centers, health promotion or preventive and promotive healthcare is a very important pillar.
Yeah.
So, and multi-sectoral convergence through Fit India campaign, Eat Right campaign is already taking place. And on tobacco control, we've done considerable work. We need to continue that work. We've also banned e-cigarettes. So this is all going on. And another important thing that we've done, I feel that, which will show impact is, once the COVID situation stabilizes, you have to, catch children young to inculcate a healthy lifestyle in them. So yoga and physical activity through schools and colleges is very important. We also started this Health and Wellness Ambassadors program. This is in conjunction with the HRD ministry, and 2 teachers in every school. This curriculum is designed by NCRT. So 2 teachers in every school are taught this course. And
Right.
then, they teach children on how health and wellness is important. So wellness in health, I would say, is actually important.
Right.
And then, of course, I am sure that you are aware, health and wellness centers, we will be having 150,000 of them, 1.5 lakhs by 2022. We already have 76,000 of them, 76,000 plus of them. And one of the major things that they do is NCD screening. So that's preventive screening. So the ASHAs and our field workers do a household-based survey and ask relevant questions. कि भाई आपको headache होता है, आप कोई smoke करता है, then do you have any kind of any kind of symptoms that could qualify under NCDs. So तो फिर 5 NCDs का actually screening होता है. That is basically for diabetes, hypertension.
Right.
Then also we do it also for cancers, the 3 cancers: oral cancer, breast cancer, and cervical cancer. And what is very heartening is, that because it is done near the households of the population, women's footfall is very, very encouraging. So more than 55% women. I have myself gone and seen in rural areas. It's really heartening for me, because you find middle-aged women, old women coming for screening.
Yeah.
They don't normally visit hospitals. They are hesitant. Men don't have time to take them. So it's really good.
Right.
And the footfall is almost 49.88 crore up to now. और इसमें से female is 26.7 crore. So they are more than the men.
Right.
So that's very heartening. So NCDs is a multi-sectoral effort, and I think that's the way to go And that's how India is also approaching it, which is very heartening,
Right. So great, ma'am. I think rightly said, a lot of things are happening now in India as well. And you have talked about healthy lifestyle. You have talked about proper monitoring and surveillance mechanism need to be strengthened as it is already happening. Talked about management information system, MIS system, or a comprehensive care, right from prevention to curative care. So, ma'am, we are also in Punjab, we are also working very closely with government of Punjab in establishing and strengthening the Health and Wellness Center along with the Strategic Institute of Public Health Education and Research, CIPHER. And we have vouched for the NCD committee at the state level so that it looks after all the things in a comprehensive way. And we are now six systems because you know that drugs sometimes comes and when they don't, when they are not present at the subcenter level, so patients normally do not take it. They wait for the drugs to come. So that is what we are trying to streamline, that at least 3 months availability of the drugs should be there. So I think ma'am rightly said that we need to do many things here. Great.
Affordability also, affordability, quality, and availability of drugs.
Yeah.
So that's a very important thing that you said. So the Amrit pharmacies, you know, and the government, in any case, through National Health Mission, the state governments are actually procuring and giving free medicine. So I think all those steps need to be taken forward.
Right.
I'm sure that if there is this multi-sectoral action, we will be able to make a difference.
Right, ma'am. Right.
And PGI collaborating with the states will give them strength.
Yeah. Right, ma'am. So along with CIPHER, ma'am, we are working. I think we have strengthened their telemedicine unit also. We have distributed around 800 dongles so that these telemedicine center work in optimal way. And we were able to reach almost more than I think 70,000 patients in the entire state through strengthening of this telemedicine unit. And it has been applauded. I think Punjab was ranked first recently ranked by the government of India in strengthening the telemedicine unit now.
Excellent.
So, ma'am, we'd like to know about your role as a chairperson of the COP8 WHO FCTC and the management of the newer tobacco nicotine products at the national and international level.
Well, I'd like to remind you that India has always been voicing for complete ban of the new emerging nicotine products such as ENDs, HTPs, etc. And this voicing started from COP6 in Moscow, which was, I think, in the year 2014. And I would say that my tenure as COP chair was very satisfying. We had to lay down tasks for finalizing agenda, including the burning issues that the parties, which is the countries, had reflected. And yes, ENDs was also at that time discussed. But in the COP, you see, there are views which range from, say, regulation to ban. That's the compass. Yeah. And there was not some kind of a consensus on the issue, but there was definitely a lot of discussion on ENDs. And I think India, I feel very proud that we have led by example. And there are many countries who actually have congratulated us, would like to do what we've done in banning ENDs at the right moment. And you must have read that US is also now thinking on those lines. So that's a matter of great personal satisfaction and institutional satisfaction, I would say.
Right, wonderful. And madam, the e-cigarette has been one thing that we can be actually proud of. And before even Russia, it was discussed in Russia in 2013.
Yes, Moscow.
It was banned in Punjab.
Yes.
And I attended Panama. It was a WHO workshop, the consultation on ENDs in 2017. And I felt very proud that Punjab was the only state which was actually doing something about it. and not many countries were doing. They were actually struggling what to do, whether to regulate or the ban. So, and it is very good that
you are very right. So congratulations to the state.
Yeah,
and also I'd like to say there were about 17 states, which had banned when we were thinking of banning. But what was happening is that a lot of litigation was going on, and people were questioning how can you do this under the drugs category. So therefore a new legislation was required, I think. So now with the national ban, those efforts of all the states have been strengthened.
Yeah. No, it is good that it has been done at the level of Government of India. So the states, they don't have to act on their own. So, ma'am, and there's another issue. So I'll like to discuss with you that tobacco industry or the vape industry is still lobbying for end to the ban of e-cigarettes. And what do you think should be our strategy to thwart such attempts?
I think, as you are quite aware, it is that WHO FCTC 5.3 that actually helps you to protect tobacco control community, especially in the government sector. And I would like to say that one thing we have to always keep in mind and be mindful of is that here the country is first. There's no commercial interest, nothing that actually that's what India has done. And we passed this law by consensus. If you have watched the parliament proceedings, so you see, when we have decided that our country is first, the interest of our future generations is paramount. Whatever may be the pressures, I'm sure that we'll be able to tide over them. But yes, we have to be alert, and we have to make sure that whatever issues are raised are addressed at the time when they are still non-issues.
Right. So, ma'am, we'll continue to seek your guidance on this issue, especially because
Sure.
I think it demands some importance.
Right. So, ma'am, you had been a key strategist in COVID-related issues recently for last 1.5 years. So, since COVID pandemic has been taking place across the globe. So, what do you think? Can you describe how you have managed this COVID and accelerated the strengthening of Indian healthcare system?
See, I would say that it was on 8th of January 2020 that a meeting was convened by Director EMR, Emergency Response, within our ministry, and he convened this meeting of what we call JMG. JMG is Joint Monitoring Group, headed by the DGHS, and it has experts from AIMS, epidemiologists from NCDs, and all related, and many can be called also, because whatever is the relevant. So they convene this meeting and to try to understand what is happening in Wuhan. What is this pneumonia? And we knew very little then, as you know. And on the 17th of January 2020 itself, we issued our first advisory. So we were actually proactive, we were preemptive, and we were graded in our response. On the 18th of January itself, we started thermal screening of passengers arriving from countries where this had spread,
right,
especially from China. So first is that. Then secondly, in COVID, lot of interaction, lot of convergent action with so many ministries, so many departments, so many experts happened, and we repurposed our infrastructure. And this repurposing, as you know, was a thoughtful repurposing. We made sure that it was not sub-district level infrastructure, say the CHPC, the community level hospitals, or say the PHCs, or say the sub-centers that were repurposed, because that was necessary for non-COVID services, for maternal services, for regular immunization of children. So district and above were repurposed.
Right.
And the kind of infrastructure that was created is tremendous. Of course, you may say that what happened in the second wave, but then I would say, given our population, given our diversity, I think even if we couldn't have done any better then.
Right.
Then also, you see, the insurance cover for COVID duty health professionals about up to 50 lakhs. That insurance cover was worked out. There was because we had to maintain social distance and all that. So I got training platform was actually it was thought of, and it was put into implementation. Again, I'd like to emphasize that it was a multi-ministry, multi-department effort. There were 11 empowered groups, which were later reduced to 6 empowered groups. So everybody was doing this work only. Yeah. Then there was this covidwarriors.com. This effort was getting volunteers to retired army officers, retired say any medical professionals, nurses, whoever would volunteer for helping out in COVID services.
Right.
So if you visit that site, that will also give you a lot of information.
Right.
And if you recall, there was a time when we were short of PPEs, we were short of masks, we were short of ventilators, because we couldn't import anything from China. Yeah. So we were importing cloth for PPEs. We were importing that respirator for N95 masks. All those import channels were closed because the Western countries and China had an explosion of COVID cases. So right, at that time, I think public-private partnership that India has shown is tremendous. The textile ministry, the the industry, and the MOHFW together. And soon we were not only self-sufficient in these logistics, but we are now exporting to other nations. So this is a huge, huge effort. Right. And of course, at that time itself, you see, we had started sharing the samples. And that's why you had the vaccines within a year. So 17th of January 2020, we had our first advisory. 16th January 2021, we started our vaccination program. So absolutely within a year. It's not a small thing that India has actually done. I think a lot of credit should be given to us as a nation, and also to how the government has acted in a very, very proactive manner. Right. And of course, you see, I would say the use of technology, as you yourself mentioned, telemedicine. So both in terms of the iGot platform is again an example of how we used online services for training or retraining our health professionals, our frontline workers. Then this eSanjeevani module that we had, basically it was for what we call e-learning. It was for e-learning, or it was a network that connected medical colleges. So some 53 medical colleges to begin with were connected with it. But then you see, it was repurposed for telemedicine, which is actually a great thing. And I would again say that telemedicine now has shown great utility, and it has a great future. Right. And again, I would like to say that all this doesn't happen overnight. So if you see that, I would say in the last 3 years that I was in health, and how much of opportunities that we got to harness multi-sectoral convergence, 22 aims, 157 medical colleges, Ayushman Bharat, both PMJ and health and wellness centers. Then the new legislations that we have, the NMC Act, the now the National Commission on Allied Health Professionals, of course, e-cigarette legislation you've already spoken about. Then also the MTP Act amendment. Then also one important thing that happened was, the amendment in the Epidemic Diseases Act, wherein the violence against doctors serving and against all health professionals doing COVID duty, that was also, taken care of by this amendment that we brought in 2020.
Right.
So lots of things done and lot of things to do still. I think Health Ministry is working so hard.
Right, ma'am, and I think I can vouch for these facts because we, PGI has been conducting this Ministry of External Affairs ITech programs for 161 countries. So we hold, as per the request, we hold 3 programs, and people from senior program managers came there and learned best practices of India during that program. And in one of the program, Dr. Paul was there, AIMS director were there, NHW director. So all the key officials were there, and they discussed about what are the good things, and everybody liked that. So at that point of time, India was, I think, rated as one of the best country which has actually revamped the entire system and doing wonderful thing in COVID. Right now.
Ma'am, since now you are with the WHO, so can you please share your experience as a WHO appointed member of the independent panel for pandemic preparedness and response?
Well, I would say it's been a great learning. And one thing very important highlighted was that health is a global good. So, vaccine equity is a pressing need to halt the pandemic. And we also learned globally that it's not affluence of nations that protects the health of citizens. If that was so, then US would not have had so many cases or so many casualties. Italy would have done better. So it is basically the integration of the entire spectrum of healthcare that matters. The primary healthcare, the secondary, the tertiary. It's the integration of all that. And also, the preventive and promotive healthcare coming together with curative healthcare. And of course, the call for action is by this panel has been equity for vaccines and also strengthening of a health system so that we prepare now for any pandemic that may strike again. Of course, the pandemic is still ongoing.
Actually, we have watched you working for COVID, the pandemic. So if you remember, I met you in maybe February 2020. So when it was just happening, actually, it was just initial stages. And in Punjab, we just had 2 cases. And you were actually worried about Punjab. So that was great, man.
Right, ma'am. So I think it was a wonderful, I think, talking with you, discussing with you. And like, what will be your messages to young budding public health specialists, ma'am?
Well, according to WHO, the goal of public health is to prevent disease, promote health, and prolong life among the population as a whole. So, and I would say that this is what the world and India needs now. So the budding public health specialists, you are our future. So please remain motivated, do your best. And I would also say that life has a way of rewarding sincere and hard work. And all the best and blessings to you all.
So thanks a lot, ma'am. And this was a very informative and motivating talk, and thanks for sparing your time. I know you are very busy with the WHO work, and I'm sure our young public health specialists will benefit from it. Thanks a lot.
Thank you, ma'am. Thank you.
So now we will have health news from Dr. Alexis. Thanks.